Hi, how are you?
Oh, good, Jason.
Jennifer?
How are you?
Good, good. So, Jennifer, tell me what brought you to Hacking Health at eHealth Expo, and tell me a little bit about yourself.
Well, I'm a midwife in Warwick. I've been a nurse and a midwife for quite a long time, and I put in a Bright Ideas application one day about putting an education app up for antenatal education. And the innovation team wrote back to me and said, yes, we like that idea, and it was channeled through the system to this, and here I am.
So you brought some people from Warwick as well.
Well, my manager came yesterday, and I believe a couple of colleagues are coming in the next day. So I'll have some support.
Is this the first time that you've been to this kind of event?
Oh yeah.
So what's the experience been for you so far?
Oh, it's really quite fun actually, and it's really very encouraging to see so many enthusiastic people putting their energy into health and innovation like this, and the way Queensland Health is tapping into people's ideas at workplace really.
So tell us a little bit more about the project or the problem that you've actually brought to Hacking Health.
Well, from Warwick Hospital's perspective, our antenatal clinic has got a high no-show rate, and our antenatal classes are poorly attended. So we believe that a lot of our women are getting information from the internet, and we want to make sure they get the right information and that they're connecting with us so that we can give them the best evidence and attract them into the clinic system so that we can keep their tests and attendance, examinations, the scans and all their blood tests up to date so that we can actually keep them safe and have healthy baby, healthy mother, happy end of pregnancy. That's the aim.
So how do you see that through what you experienced yesterday and where you are now? How do you find yourself going in terms of getting to where you want to be?
I think we're really at the bottom of the journey, and we've got a huge amount of work ahead of us. It's a massive idea that's had to be extremely simplified to get a clear indication and direction of the plan to be put forward as something that would be purposeful, selling to health service as an effective methodology to talking to customers. It's a new way of talking to patients and customers of the health service, whether it be antenatal services or any service. We've got a whole social change in the way people speak to each other today, and with technology, I think we need to harness that, and we also need to sell our services.
So at the moment then, a lot of the things that we're seeing, especially from running these kind of events and being part of that innovation community, is that patient-centric term. There is also that notion of having your perspective and your perspective put onto that view. So that sounds like with some of the information that Carolina actually has been able to find out, has been really getting to some really good info.
It is, and we did some surveys, and we're finding that people like the idea, but we've got to take our emotion out of it and give people what they want and put it in a way that is acceptable to them. So they have choices, they're empowered, it's their choice to use the app. We've got to actually make it something that what people want, not put something that we think they want.
Yes.
It's got to be what they want, and it's got to be framed and designed in a way that's going to attract a particular demographic. So if it's young people, it'll be in a different kind of theme as opposed to, say, different cultures or different age group sets. So some people may just want, say, calendar prompts. Other people may want the scrapbooking memory idea. Other people just want to know that they're on track and they get on with their life. They're not interested in putting other stuff on the app. So people can make it what they want. They get to choose. They can drive certain parts of the app to be what they want to make it.
So hopefully through the next, it'd be interesting when you you get up on that stage and pitch in front of the whole crowd. So
Whether I can actually say that without getting all tongue-tied. That's not my best suit.
I'm sure you'll do fine. There's lots of people here to support you. There's a lot of people here to be very in a positive environment. Very a lot of people that want to make sure that you do well. So.
Yes, there is, and I'm really appreciative of that. And I'm very impressed with the setup that you've put together here with Hacking Health, and everybody that's in the room is kind of this energy. It's quite palpable. It's quite productive and a very proactive way of teaching adults to move into an area that they haven't actually embraced before, because each of us has a way of working in our work life, what we do every day. So this is taking us out of our comfort zone and trying to quickly get us up to speed in another area of working, to be able to sell this idea, which we feel strongly about, but we've got to actually put it in a way that's going to make sense to the people that are going to be looking at it, I guess, so that we're going to impress them. We don't sort of waffle on too much.
So there does come into like a commercial reality.
That's right.
There's all the case of what's important for the business, what's important for yourselves, and what's important for the people that you're supporting.
That's right.
So everyone needs to have get something from this.
That's right. That's absolutely right. And the main thing is to actually improve people's health.
Yeah.
And the only way we're going to do that is to get them to interact with us. And if they don't know we've got this service, and if they don't know how easy it is to talk to people in the service, then they're going to still be left wondering, and they'll end up going out to the internet and possibly get information that is less than safe, possibly.
Yeah.
And they have gaps in their understanding, and therefore their health may suffer. And so pregnancy matters. It may be that the babies may suffer, the women may suffer.
And the whole family network.
That's true. That's right. It's really about community health.
Yes.
It is a community health issue and a population issue. And if we don't address the way we speak to our clients, our patient base, in a way that they can really understand us, we know what we want to say, but they still don't understand us a lot of the time. They nod, but they still don't understand. But we've got to actually do that better.
Yeah. So appreciate that you coming from Warwick and bringing the team, bringing the idea here.
Oh, that's right.
So it's actually we'll see what comes off tomorrow, and I'm sure we'll see a lot more of you.
Yes,
Thank you.
hopefully. Thanks very much for letting me come. Okay, bye.
Cool.